In this video lecture, I'm going to talk about systemic lupus erythematosus or SLE. And as you may know that SLE is an autoimmune disease characterized by the formation of immune complexes which trigger inflammation and lead to tissue damage. Immune complex, it is formed of antibodies together with the antigen. So formation of immune complex activate the complement or the classical pathway of the complement, and this activation starts by activating complement component number 1. And as can be seen here, this is C1q of the complement component number 1. It binds to the immune complex, and this will initiate a cascade of activation and lead to formation of membrane attack complex and aflatoxins. Aflatoxins, these are complement component number 3, the short fragment, and the short fragment of the complement component number 4, and the short fragment of the complement component number 5. And actually this will lead to inflammation. So SLE is a multi-system disease and can affect many organs in the body, many parts of the body. And for example, as can be seen here, it has effects in various or in different parts of the body. This is, for example, the glomerulus or the glomeruli. So the position of immune complexes will lead to what is so-called lupus nephritis, and as you know that this deposition trigger formation of some cytokines, for example tumor necrosis factor alpha, interleukin number 1, and other interleukin number 17 and interferon gamma. These are pro-inflammatory cytokines and lead to inflammation or the nephritis. Similarly, if these complexes, these immune complexes, of course in the case of SLE, the immune complexes are circulating complexes. So when they reside, they activate the classical pathway of the complement. For example here, if they resided here in the blood vessel, wall of the blood vessel, so they will bind to the endothelial cells of the blood vessels, and maybe these antibodies are anti-endothelial antibodies, and when they bind to the endothelial cell, this will initiate an inflammation in the blood vessels through some pro-inflammatory cytokines, and may lead to vasculitis. A patient with vasculitis may present you with pyrexia of unknown origin or excessive sweating, or may present with loss of weight. A picture that is very similar to a picture of patients with Mycobacterium tuberculosis. So, and also patient of SLE may present also with anemia, and this regarding the blood vessel when the immune complexes, as I mentioned, it is an immune complexes disorder. When these they reside here, they will lead to vasculitis. And in the lung, so immune complexes, when they reach the lungs, they will lead to pleurisy or inflammation of the pleural cavity. However, in the central nervous system, these immune complexes, when they reside here, the patient may present you with very severe depression or with abnormal headache, or a patient may suffer from change in the mood. This is the neurological manifestation of the SLE. In the tongue, so the patient in the mouth, the patient may present you with ulcers, oral ulcers, and usually these ulcers are painless ulcer. They are not painful ulcer. Regarding the joints, also it can affect the joint, but however, as can be seen here, the cartilage is intact, the bone is intact, the synovial membrane is intact. In contrast to rheumatoid arthritis, in case of rheumatoid arthritis, the bone and the cartilage get distracted with hyperplasia of the synovial membrane. But however, here the patient will present you with swelling of the joint with intact joint parts. And also patients with SLE may or cannot resist or cannot understand the ultraviolet radiation. They cannot withstand ultraviolet radiation. So this is known as photosensitivity due to SLE. So in the heart, as I mentioned, the SLE may predispose to pericarditis, myocarditis, or endocarditis due to